The most recent change that actually Lori and I did together, the most recent change presentation discussion was with some of the nursing leaders in this very room. And what I asked people to do beforehand was just think about what was most stressful for them. Assuming that there was some stress. One person said that change wasn't stressful and that change was exhilarating, which is true. So this is a synopsis of what some of the leaders in this room right now actually said. What's been stressful right now is that, the volume of change is tremendous. And who in this room could say that that's not true? Another one is just sort of, it's what Art said and what has been said in the last hour and a half. Deciding the value of the change. Am I in? Does this matter to me? And that's huge. Another one is just, it's stressful to maintain a positive focus. I felt there was a lot of ownership for, I want this change to happen at Meriter, I want this change to happen with staff. And when I say this change, it's all of the stuff that we all are experiencing day after day after day, including changes that are ahead. And I think people said, you know what, I want to be positive. And that's tricky sometimes. And then another challenge was communicating changes to staff. The tremendous responsibility to make sure that people understood what was happening and why, which the thought was, if people understand, it's easier. So those are some of the things that your leaders, including some of the people right here, said. Okay, then they also talked about coping strategies for them. Some of them will sound familiar to you. One of them was believing in the cause. If I believe in the cause, it makes it a whole lot easier. Not easy, but easier. Another one that's helpful is being forewarned. You do know that EPIC will be changing in September, right? Just kind of knowing what's ahead. And I think we use that in nursing. If I'm going to do something painful to somebody, we know that if we tell them in advance, it's actually less painful. Best practice. Another one is finding a trusted friend. Phoning a friend is a good thing. And I would add that, you know what? Phoning a friend is especially helpful, or talking to a friend, if we then do something as a result. I don't think it's that great if it's two people sitting around and then just sort of complaining about stuff, or, it feels sort of good for a while, but then nothing changes. And if anybody who knows me knows that what I always say is, you know what? The person that needs to know your opinion is the person that whatever it is relates to. And that's the only way a change can occur in a relationship. So that's a good thing, I think, to remember during all of this. What are you doing and what are you talking to that friend about? And is it productive and helpful to you and supportive? And then I think the last strategies, before we throw it out to all of you, who I'm sure have opinions, is something that I would say self-awareness. It's tremendously helpful to have some sort of self-awareness and go, you know what? I know that whenever a change is afoot, I think, bad idea, I'm not going to like it, it's going to be hard. So I know that's my natural tendency. And if I use that and turn it around and say, okay, that's what I always do, and then I also know that I can get through it, so I just need to reframe it for myself. That's good to know about oneself. Also, I think knowing that, that grief accompanies change is actually a really good thing. It's hard to give certain things up, even though we might like the change that's ahead. Even good change is stressful. And then knowing that we all respond to change differently. So those are the changes that I think have to do with self-awareness. And I think it does boil down to, you know what, there's the only thing that we can really do and have control over is how we respond to something. And it's good to sort of remember that. I think it's kind of a freeing experience to know that, all this stuff is going to happen. And it is true. If all this change wasn't happening, we would be in a pretty stagnant organization and we wouldn't last. However, I think that being aware of what our response is, and knowing that in the end all we can control is who we are and how we respond, is actually really helpful and freeing. So with that, What are your thoughts? How has it been for you? Can you relate to this?
If anyone has comments, raise your hand, I'll bring the mic to you.
And I can bring it too. I know there's, I mean, it's a lot of information, but I also think these are things that all of you here have thought about before. Yes?
I find it very grounding to bring myself back to thinking about the patient and the patient experience when I'm working with them and how my attitude affects that.
Okay, see, now this is where it's really hard to have a discussion because we're talking to the recording. Dear recording, it's grounding to, I'll let you finish.
It's grounding for me to, if I'm worried about change, to focus on the patient and the patient experience and how my attitude affects the patient experience. That keeps me focused on what I'm doing in my job and the purpose of it, and that's helpful.
Great point, I would say. Other thoughts?
I think keeping perspective.
So how do you keep perspective, knowing that epic change is ahead and all kinds of other things?
No one's died yet.
Did you hear that? No one has died yet. All right, can anyone top that? Chuck, do you have any thoughts?
Ambiguity keeps...
Wait.
Ambiguity keeps popping up in my mind, and how we live in that state of not really knowing what it's going to turn out. But like you said earlier, we've been through it before in different ways, different content, but it seemed to work out in the past. So holding on to that hope that it's going to do it in the future too.
Is it helpful to hear what Art had to say? Any thoughts about that? Did you really think the CEO was in control? Will I still have a job by the time this is over? Good. What? Pat Ryan, are you trying to say something?
I will.
Okay, good. See, people think that it's hard for people to talk in both auditorium, and I challenged the group by saying, you know what? I think it can happen. I've seen it happen here before.
What I find especially helpful, I've worked with a number of people in various affiliates in recent months about order sets and so forth. And what has come across very strongly to me, and from what I've heard with others, is that people throughout UnityPoint Health highly respect Meriter and what we do, what we stand for, and that from the standpoint of we may feel that we're in less control just because we're working with something that an organization that is larger than it used to be. But I think we go in with probably more control than we think. And the phrase, the arc of history bends toward justice, in this case, we have the power to bend that arc of history toward quality. And I think that we have, to some extent, a responsibility because of the expectations that other people in the organization place in us.
And how are you coping with the change day to day? What do you do?
I'm continued to be involved with people, phone calls with order sets, and we just recently faced a discussion about adopting some diabetes policies as the first in the affiliate and in the organization to be corporate wide, and how to deal with those.
So I'm going to piggyback on to what Pat said, because that's actually a thought that I was thinking is that with this change and also being very heavily involved with the Epic integration, is that out of change also comes great opportunity. And that's something that I've certainly personally experienced is the great opportunity. And some of those great opportunities is what really Pat just said, is that the opportunity is for Meriter to be leading this change, and we are leading an enormous amount of change. And there is a lot of listening, and from some of these other organizations that are basically, some silently and some not so silently, but are basically kind of cheerleaders for Meriter because they're actually being refreshed that's occurring. But again, the point that I came to my mind was the fact is in these significant changes also are significant opportunities for us. So.
So I'm personally a person that really, okay. I'm personally a person that really enjoys change, and boy, do I have a lot going on right now. So this is an exhilarating time for me, but I still find challenges with that, primarily people that are slower to change. And the way I've found to cope with that typically is just viewing it as just another change that I have to try to help move along, rather than getting bogged down with it and letting it get in the way of my change. It's just another change, and it helps keep me going.
Jeremy just became the clinical specialist at Child and Adolescent Psych after not having one for a few years, so he has a couple of years worth of stuff to catch up with. Someone else wanted to. I saw someone else. Another thing that I'm thinking of is I obviously really like my job because I never leave, but at the end of some of these days, I think it's been challenging, and I agree with what was said about, I think we are really, really well respected within the UnityPoint system as we work on some of the issues that face us. And you can go, wow, this is really interesting, and I wonder if I can figure this out, and, I wonder how this will be, and all of that stuff. But then some days I go, I have just got to get out of here and ride my bike and forget about Meriter-UnityPoint Health and do something completely different. And that has been that's really helpful. It's nice that the weather has been great. Other thoughts? This is actually my exercise program. It's like, who was it that goes around? David Letterman. It's just like being on David Letterman. Wow.
Hey, Sue. I've been reading a book lately that's called The Gift of Uncertainty. And the major strategy that the author recommends is embracing the concept of maybe. And using that, maybe things are going to go the way I think they are, and maybe they aren't. Maybe it's going to be really horrible, but you know what? Maybe it's going to be really terrific. So I've been finding myself trying to hang on to maybe as I go through my days, and it actually works pretty well. It works really well with my boys, I can tell you that. I've been trying it out on them a lot.
Thank you.
So I think Megan would be our last person.
Megan? As in Megan Henderson?
To sum it all up, Megan is going to...
All right. And now we have Megan Henderson, the other clinical specialist from adult psychiatry.
Well, if people know me, they know I talk a lot about self-kindness. And I think there's a piece of this that I think there's a very delicate balance of being transparent with your frustrations in safe places, and then not letting that, cloud you and be negative. And I think it is a really tough thing, but I think we have to kind of constantly forgive ourselves when maybe that transparency or frustration kind of bleeds over, and we have to dial it back and readjust. And so I think in this process of change, as I'm fairly new to Meriter, that's kind of what I'm learning a little bit of, is continuing to challenge that equilibrium of transparency and also positivity.
So thank you. So in closing, I would like to say thank you to all of you for being here, for your thoughtful responses, to Art Nitsa for being personal, about what happens in your life. And I think your responses were so thoughtful and so, I think, applicable to what's happening with all of us here. So thank you very much. And of course, as always, to Lori for pulling it all together. So thank you. Have a great rest of the day.